I appreciate it.
First one, did you get this one? Okay, I'll ask Councilor Baker from Cherokee County to give the invocation.
Our gracious Heavenly Father, let us thank for this day and that we can come together and do your work for the Cherokee people. Keep your guiding hand over our soldiers overseas and keep them safe and their families here at home, and guide and direct us that we'll just do your work. In Jesus' name we pray. Amen.
Next we have roll call. Please let us know you're here.
Bradley Cobb. Janelle Fulbright. Here. Bill Anglin. Bill John Baker.
Here.
Jack Baker. Harley Buzzard. Julia Coates. Joe Crittenden.
Here.
Jody Fishinghawk.
Here.
Meredith Fraley. Here. Don Garvin. Tyler Glory Jordan.
Present.
Curtis Snell. Chris Stowe.
Here.
David Thornton.
Here.
Kara Callan Watts. We do have a quorum.
Next, I'll entertain approval of the September 14th, 2010 regular session minutes.
Second.
We have a first and second. All those in favor say aye.
Aye.
Any opposed? Motion carries. Next, we have two reports, and from the Claremore Service Unit, George Vallier, you are the next contestant.
Morning. This is pretty simple. Our visits have gone up over 13%. Our collections are still up. Since we're into October, I already know that we finished the year at just over 100,000 more than what we collected the year before. Our Medicare was actually down 700,000 over the year. I attribute that to we're down to 2 internal med docs, which is down from 5. We're about to finish our roof project. I think I mentioned before, we are not having a drive-through flu shot clinic. We're having walk-up clinics every day there in the hospital. We have started our IT upgrade and are trying to get area office to move a little quicker and get our emergency room remodel started. We had given them money for architectural and engineering, give them $100,000 to get that started, and then they turned around and gave it back to us because the Dallas, whoever it is in Dallas for Indian Health Service, didn't have any architectural and engineering firms, so they gave it back to us, and we're trying to get that off high center. So, if you have any questions.
Any questions regarding Claremore Service Units? Councilor Fishinghawk.
Can I get a card from you? Now that we've taken over Delaware County as part of our district, I'm having to deal with some contract health issues up there, and I'm not familiar with how you all do it at all. And could you send me some information on contract health? Please, resources, people call different things. I'd appreciate it.
Okay.
Anything else?
Anytime you have an issue or a constituent complaint, you can email me, call me,
Okay.
and I'll get you an answer
Okay. Thank
to
you.
it.
Any more questions? Thank you very much.
Thank you.
Next is Cherokee Nation Health Services. I know Melissa Garr and Dr. Grimm are out, and Rick Kelly, I believe, is going to handle the services here.
Yes, good morning. I believe you have our September report, and I'm be happy to take any questions you might have. I do have some flu shot information to pass around.
I'm sorry, Councilor. So, you are.
Rick, could you talk to Melissa and see if she can get us a report on the status of the construction at the dam site? I know we've had some really great weather here the last several weeks, and so just kind of like some feedback on whether or not they're ahead of schedule, behind schedule, and just a general update on those particular issues. improvement project there. Thank you.
We can do that.
Counselor Fulbright.
Yes, thank you. I would like something similar to what he requested, but for the Redbird Smith Clinic Pharmacy. It's been closed down and using a mobile home out back for quite a while, and I know there was a problem with them not ever getting started, and I'd just like to know how it's coming along.
Okay, I understand there was an issue with some flooring, and I'll get your response.
Okay.
But I think everything is supposed to be scheduled now, so we'll see what your response is.
Well, I know they had told me down there once they had given the construction company a certain time limit to do it, and they showed up to start on the last day of, so I think someone told them, go away, go get somebody new. So there's been several months process already. So.
I think they've completed the renovation. They're waiting on this flooring so they can install that.
Oh, well, great. Okay. I hadn't heard, so I just wanted to know.
Sure.
Thank you.
Counselor Fraley.
Do you have any idea of when the phone system will be completely installed at Salina?
Was there something in the report on that?
They just said it's waiting some licenses to activate. Okay. Because I received several calls about the phone system.
Sure.
And they told me they were installing a new system, but wasn't sure when it would be completed.
Okay.
So just hold on.
Okay.
Thanks.
Counselor Fishinghawk.
Yeah, I had a question about follow-ups to contract skills. I had asked it last month. We have people that when they get referral for a contract health, they go out, they do their surgery. They come back, they have to go for a checkup. Will they have to go through contract health again for the follow-up visits? Well, your surgeons do not like them to go somewhere else because of liability reasons and everything else. So I'm curious as to why we don't make the follow-up visit part of the first referral.
Okay, I'll get back with you on that one too. I'm sorry I can't answer that, but hopefully Brett Hayes can respond to that. I'm not sure why they don't.
Okay, and then could you get me a list in order of the contract health priorities? If you send people out to contract health.
Right. Okay.
Okay, thank you.
Medical priorities?
Yeah,
Okay.
thank you.
Counselor Jordan.
Yes, I was just going to ask, I know health is one of the departments that's coming to the community meeting tonight. Will you have them be sure and bring information so that we can get that out of Hastings flu shots this week?
Sure.
I'd sure appreciate it.
Glad
We'll
to.
probably even have them come up and announce
Okay.
times and where you need to be and all of that, if you would. That's pretty critical to our folks right now.
All right.
Thank you.
Sure.
Counselor Fulbright.
Thank you. I wanted to give you a positive comment about the Redbird Smith Clinic. I was out there one day this week, and as a matter of fact, I went out there early yesterday morning. I've never seen a more beautiful facility with most beautiful floors, the grounds. That place is like a park. It's really, really nice. When people walk in, it's so clean and nice, and people are treated well, and I'm really pleased with the way everything, the appearance is to be commended, because I've had a lot of other experiences with hospitals in the past 6 months at other places, and ours is truly outstanding. Thank you.
Thank you. We'll share those comments with the staff.
Speaker Fraley.
I'm sorry, my mind's working spurts. Do you know when the mail order prescription service will be available for Salina, or is it activated now? We have some elderly people that have difficulty getting to the clinic as frequently as needed.
Well, I know we're gonna centralize that and offer it out in Muskogee, so they'll have that service, but that's still not open yet. So I'll find out.
Okay, we appreciate it.
Sure.
Any more questions? Counselor Buzzard.
Yes, I'd like to have a copy of those medical priorities too. So,
Sure.
if you could email them to me or how.
Can do that.
Any more questions? Cherokee National Health Services. Whatever you have. If there's no more questions, if you are finished.
Okay, thank you.
I could make you a copy of that.
Old business, there appears to be none. New business, there appears to be none. Do we have any announcements? I have no announcements. I have people looking at me like, oh, you want me to, oh, please, Councilor Snell.
I want to thank everybody that donated to my little raffle meal Saturday. Thank you. Thank you for the special Olympics. That's, a friend over there said you will come down.
Just one more little plug for our community meeting tonight. We're cooking our hog as we talk, and we'd sure like for y'all to come down and eat with us. All you all coming tonight too.
I have
all the pork.
Well, pork.
I have one, I've been handed, I know that participation is greatly encouraged for the Northeastern Oklahoma Regional Summit here at NSU. It's on October the 26th. We have 4 counselors that are planning on attending, and I know it's important. If you have any more questions on that, please see Ms. Ragsdale. I know that they're really wanting some active participation here. So the next health committee is scheduled for November 22nd at 2 p.m. and I will entertain a motion to adjourn. Okay. First and second, all those in favor? Aye. Any opposed? We are adjourned.